COVID-19, short for coronavirus disease 2019, is a contagious respiratory illness caused by a novel coronavirus called SARS-CoV-2. It was first identified in December 2019 in the city of Wuhan province in China. COVID-19 quickly spread across the globe, leading to a pandemic. The virus primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. It can also spread by touching surfaces contaminated with the virus and then touching the face, particularly the nose or the eye. To prevent the spread of coronavirus, public health measures such as wearing a mask, practicing physical distancing, frequent hand washing, and avoiding large gathering have been implemented worldwide. Vaccines have also been developed and administered to help prevent severe illness and reduce the transmission of the virus. There are three general phases of infection with COVID-19. The first one is incubation period. This is the time between getting infected and when symptoms appear. In general, you may see symptoms start 2 to 14 days after infection. The incubation period varies among individuals and it varies depending on the variant. Even though you may not have the symptoms in the incubation period, you can transmit the coronavirus to another person during that stage. This is why if you suspect you were exposed to someone with COVID-19, you should self-quarantine, watch for symptoms, and consider getting tested 4 or 5 days following the exposure. This way you can help prevent the spread of COVID-19. The second stage is acute COVID-19. Once the symptoms appear, you have entered the acute stage. You may have fever, cough, or other COVID-19 symptoms. Acute COVID-19. So once the symptoms appear, you have entered the acute stage. You may have fever, cough, and other COVID-19 symptoms. Active illness can last for 2 weeks if you have a mild or moderate coronavirus disease, but severe cases can last months. Some people are asymptomatic, meaning they never have symptoms but do have COVID-19. If you develop symptoms or suspect you are asymptomatically infected, if you have a mild or moderate coronavirus disease, but severe cases can last months. Some people are asymptomatic, meaning they never have symptoms but do have COVID-19. If you develop symptoms or suspect you are asymptomatically infected, call your healthcare provider following testing guidelines. The third stage is COVID recovery. Post-COVID symptoms such as lingering cough, on and off fever, weaknesses, and changes to the senses of smell and taste can persist for weeks and even months. Persistent symptoms are sometimes known as long COVID. Test results may remain positive for weeks to several months following infection, but this does not necessarily mean you are infectious. Most people are no longer infectious beyond the recommended isolation precaution period. COVID-19 recovery is the third stage. COVID symptoms such as lingering cough, on and off fever, weakness, and changes to your senses of smell or taste can persist for weeks or even months after you recover from acute illness. Persistent symptoms are sometimes known as long COVID. Symptoms can be severe, mild, or absent altogether. Some people recover from COVID-19 with no problems, while others are left with lingering effects, and still others require hospitalization or die from COVID-19. If you have any of the following symptoms, call your doctor. He or she will say whether you need a test or recommend what you need to do. These are the symptoms: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, and congestion or runny nose. Severe COVID-19 is when you feel like you should call the emergency unit. The symptoms for severe COVID-19 is difficulty breathing, persistent pain or pressure in the chest, new confusion, inability to wake up or stay up, the bluish lips or face, Those with mild cases of COVID-19 usually recover in 1 or 2 weeks. For severe cases, recovery can take to 6 weeks or more, and for some, there may be lasting symptoms with or without damage to heart, kidneys, lungs, and brain. In South Africa, as in other parts of the world, COVID-19 primarily spreads through several modes of transmission. The main types of COVID-19 transmission in South Africa are respiratory droplets. The virus spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. When these droplets are inhaled by individuals in close proximity to an infected person, they can become infected as well. Close contact is the second one, when an infected person, such as being approximately 1 meter of them, can lead to transmission of respiratory droplets containing the virus. Surface and objects is another form where you touch objects contaminated with the virus and then touch your face, mouth, and nose. However, it's important to note that while surface transmission is possible, it is considered less common compared to respiratory droplets transmission. Third one is aerosol transmission. There is a growing evidence that suggests COVID can also be transmitted through aerosols, which are similar particles that can remain in the air for longer periods. These particles can be generated through activities like speaking, singing, breathing in enclosed spaces with poor ventilation. Another one is oral transmission. Although less common, there have been instances of COVID-19 transmission through facial oral route. This can occur when an individual comes in. One is oral transmission. Although less common, there have been instances of COVID-19 transmission through facial oral route. This can occur when an individual comes into contact with the surfaces or objects contaminated with the virus and then touch their mouth, their nose, or eyes without proper hand hygiene. To mitigate the transmission of COVID-19 in South Africa, public health measures such as wearing masks, practicing physical distancing, frequent hand hygiene, and avoiding crowded indoor spaces have been recommended. Vaccination campaigns have also been initiated to reduce the impact of virus and protect individuals from severe illness. There are two basic types of tests for COVID. There's a viral test. This test can tell if you are currently infected with coronavirus. A swab is placed in the nose or mouth to gather samples. There are two types of viral tests, laboratory test and an antibody test. This is a blood test that can show if you were previously exposed to or infected with the virus that causes COVID-19 and if your body has created antibodies in an attempt to defend itself. It takes at least 12 days after the exposure for your body to make enough antibodies to show up on a test. Antibody tests are not recommended to determine if you currently have COVID. If you are infected with COVID-19, it's important to take certain steps to protect yourself and others. Here are some guidelines to follow if you test positive for COVID-19 or have symptoms consistent with the virus. Isolate yourself. Stay at home and isolate yourself from others, even if your symptoms are mild or you asymptomatic. This helps prevent further transmission of the virus. If possible, designate a specific room and a bathroom for use to minimize contact with others in your household. Seek medical advice. Contact your healthcare provider or the local health authority and inform them about your symptoms and positive test results. They can provide guidance on managing your symptoms and may advise you to seek medical attention if your condition worsens. Monitor your symptoms. You must keep track of your symptoms and seek medical attention if they worsen or become severe. Symptoms such as difficulty breathing, persistent chest pain, confusion, or bluish lips or face require immediate medical attention. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds or use a hand sanitizer with at least 60% alcohol if soap and water are not readily available. Avoid touching your face, especially your eyes. Avoid touching your face, especially your eyes, nose, and mouth. Wear a mask Wear a mask, especially when you are in the presence of others or need to leave your home for medical care. This helps prevent the spread of respiratory droplets that may contain the virus. Notify individuals that you have been in close contact with, especially in the 48 hours prior to developing symptoms or testing positive. They should be advised to monitor their health, get tested if necessary, and take appropriate precautions to prevent further spread. Maintain a healthy lifestyle by eating nutritious food and staying physically active if your symptoms allow. You must also remember that these guidelines are general recommendation and it's important to consult with healthcare professionals or local health authorities for specific guidance based on your situation and local protocols. The antiviral medicine Paxlovid was registered in South Africa and authorized to treat COVID. For mild cases, stock up on medication. There is no cure for COVID-19, but mild symptoms can be managed with the over-the-counter medication. Call your pharmacy and lay on pain relievers such as ibuprofen, aspirin, and fever reducers such as paracetamol to help with sweats and chills, cough medicine to help you relieve or suppress a cough, vitamin D, zinc, vitamin C, and vitamin B complex. The National Institutes for Communicable Disease note that although supplements have not been shown to actively influence COVID progression, they are often taken to strengthen immunity and are generally safe. They are included in the managing guide for COVID. Make sure you have medication needed for any existing chronic condition and keep taking them correctly. For severe cases, you need to contact your doctor or seek medical attention immediately.